Nurse Talk 101, conversation from real nurses, because being in nursing is more than just a job.
Welcome to Nurse Talk 101, the podcast where we talk about a little bit of everything. This is a space for honest conversations where we talk about things from navigating school all the way to navigating life.
I'm one of your co-hosts, Tiara Smith.
And I'm Tori.
And whether you're a nursing student, a bedside nurse, an advanced practice nurse practitioner, or you just simply want to know what we're talking about, this is the podcast for you, because it is a reminder that you are more than just a job title.
Honest conversations, real experiences.
Nursing school didn't teach you this, but Nurse Talk 101 will.
Let's get into it.
Well, first, I'm Tiara Smith. I am a family nurse practitioner, and I specialize in internal medicine, family medicine. I have been in healthcare since 2009, where I started my career off as a CNA. I then went back to school in 2013, and I graduated as an LPN in 2014. And then I went back to school in 2016, where I bridged to RN. I graduated, which is where I met Tori. I graduated in 2017. Later on, I did go on and get my bachelor's degree in 2019. And in 2022, I graduated with my master's degree, and that's also when I became a family nurse practitioner.
And I'm Tori Taylor Spencer, a psychiatric mental health nurse practitioner. I've been in nursing since 2011. I started out as a CNA. I went to bridge over as an LPN in 2013. I graduated from RN school in 2017, where I met Tiara. And then I became a nurse practitioner in 2022. So, I know you guys are wondering what this podcast is all about. We want to be clear in letting you know that this is not a podcast for nurses. We're nurses with a podcast.
So with that being said, on Nurse Talk 101, we will simply talk about things from all walks of life. Yes, we will have information and education that will help those wanting to get into nursing, those still trying to figure out if nursing is for them, and those still navigating their way through nursing school. But also, we will talk about everyday things. We're mothers, she's a wife, we're women, we're sisters, we're friends, we're family. So we're open to talking about things throughout the whole entire lifespan. So if you guys have anything that you're interested in hearing from us, please feel free to drop it in the comments, shoot us an email, and all of that, because we will promise to keep you with different topics every other week.
Now, we're going to get into how Tiara and I met. You heard us say that we met in nursing school.
Yes.
So we were both LPNs, and we went to Lutheran School of Nursing in St. Louis, Missouri. We started in 2016, and that's when we met, and we graduated in 2017, and we've been stuck together like glue ever since.
Yes. So it's crazy how we met, honestly, because if you're from where we're from, you know that people like to say it's a difference. I'm from East St. Louis, Illinois. Tori is from St. Louis, Missouri, right? But nursing school brought us together, and now we don't see none of that. When I tell you, meeting this girl was one of the best things that could have happened to me, and we've just been attached to the hip ever since. So one day, we were always talking about nursing things and how hard nursing school was for us, and we wanted to do things to help people through, so we decided to start a blog called Nurse Talk 101.
Mm-hmm. We wanted to be in a space that we wish we had going into nursing. We went into nursing separately, of course, before we knew each other, but that's, I think, the thing that kind of connected us most was because we didn't have mentors. We didn't have anybody guiding us, telling us this is the class, these are the classes you need to take, this is what you should do, just kind of leading us down the right path. That's something that we figured out on our own, and we just wanted to be a resource for other people getting into nursing, navigating nursing school, because we know how hard that is, and then even navigating clinical life, like after nursing school is over. That's something that a lot of people don't talk about either.
And also the personal aspect of it all. Having somebody who's your support person. We, along with a few others, became each other's support person. Like in everyday life, we will leave out of nursing school and still be dealing with everyday life, and we helped each other get through that. So we wanted to be support for others. We have people reaching out to us all the time for our support, and we're always welcome and willing to give it. So we decided, why not share what we got with everybody else? We went through it, we made it through. We know how it is, and behind these titles, we're everyday real people. So why not do this and give back to you guys?
And so that brings us back to a little bit more of what we're going to talk about. You guys can expect to hear a little bit of everything from us. We're going to talk about our own individual life experiences outside of nursing. We're going to talk about nursing school, classes, study tips, certain topics, mental health. We're going to talk about being a wife, being mothers, navigating businesses and being entrepreneurs.
Yes.
So it's going to be a little bit of everything. Please don't get it confused and think this is going to be strictly for nurses. This is for everybody.
Yes, the information we're giving you guys, anybody can use. We're also going to give wellness and health tips. We know where we live. We know we're in an underserved, underrepresented population, and we want to make sure that we're providing education that helps those in our community. Everything we do is so that we can educate, because there's not enough education out here. So we want to make sure you guys can get that from us. So please always let us know if there is something you guys are specifically struggling with or talking about, and we will do our best to get that into this.
Okay, so getting into some of the real life stuff,
Yes.
We did take a break. I know our supporters were kind of like, where are Tori and Tiara? So, as far as me, I think shortly after nursing school, I worked maybe a year after finishing our RN program, and then I moved to California. So I was in California for about 8 years with my husband and my kids. I went back to school out there, and then I actually just recently relocated back home. And of course, all those years in between, there was a lot going on. We had the pandemic in 2020. I had a baby in 2021. Just moving back and forth. We kind of dropped the ball a little bit, but we back.
And for me, we graduated RN school November 2017. When I walked across that stage, I was 4, almost 5 months pregnant. So I did birth a new child within that time. I purchased my first home within that time. I also started another business. We went back to school. I raised my children. I dealt with some grief. So we literally dealt with some real life situations, which is what exactly brought us back to you guys. We dealt with those situations, we navigated it through, and we still maintained our professional careers, we maintained our entrepreneurship, we maintained our families, our friendships, and so much more. So that's why we feel like we're perfect for helping you guys to navigate through certain situations that you just may be wondering about.
Mm-hmm. Because again, we're not just nurses, we are real people. Nursing is a part of our identity, but it's not all of who we are.
Yes, and like she said, real people with everyday struggles. So please don't think, okay, they're nurses, this is not for us. They don't have struggles. We dealt with some things, and we'll get into those in further episodes. But you guys gotta tune in and stay tuned with us to find that out.
So why now? Right now, I think things have slowed down a little bit. Nobody's in school right now. Tiara has two flourishing businesses that are kind of stable, where she can kind of sit back and have people do the work for her. And then I also started my own private practice while I was out in California. So I'll be celebrating my 3rd year this year. Now that that's kind of going smoothly, I'm back home with my girl. We figured this is the best opportunity to kind of get back to what we started, why we started Nurse Talk, and to get back to helping people out and speaking our truth.
And why not now, right? Why not? When we're sitting back every day and we're seeing so many things going on. All you guys watch the blogs. We're all in social media. We're all online. And with so much going on in today's world, what better time than to help educate and teach your people than now, right? I specialize in internal medicine. Tori specializes in mental health. Those things are great topics that we really need to touch bases on. But more than that, we are everyday people. You have people out here struggling who don't have nowhere to turn to, or they're seeing things that don't relate to them because it's just people who don't relate to them. But we relate to the struggles. We relate to a lot of things going on today. So when the opportunity presented itself and we got back into it, it was literally like a light bulb went off in our head, like, it's time.
Why
It
not?
is time. It's time for you guys to get back. And we were super excited about it. So that is why we're here.
So I wanted to touch base a little bit on why we chose nursing. I'll go first. So for me, I think it was I get this question all the time and I'm just like, I don't know. It's just always been like, this is what I'm gonna do.
Yes.
I did have a couple nurses on my dad's side of the family growing up. But I've just really always had a true passion for helping people. And I know that can sound so cliche, especially now where people are going into nursing for all the wrong reasons, and we'll talk about that in another episode. But it's just kind of always been a part of me. I've always been helping out ever since I was like probably 2 or 3. I was raised by my grandmother, and people would say, Tori raising her, she not raising Tori. I helped raise my siblings, my younger sister and my younger brother. I was the person that was babysitting all the kids when I was younger. So it's kind of just been, I think, a part of my temperament. I remember having my first baby and I was like, I want to have an urgent care for kids. And I just knew this is what I was going to do. And so I had an experience with my son. He was actually like a month old. He was hospitalized in the ICU. I was probably like 19. It was the scariest thing I had ever experienced at that moment in my life. I didn't know what was going on. And I had a nurse that was like his primary care nurse while he was in the ICU for 2 weeks straight.
Okay.
And she was like, what are you planning to do? You 19, you got 2 kids, what are we doing? And I said, I want to be a nurse. And she said, I'm gonna tell you something that I wish somebody told me. She said, people go into nursing for all the wrong reasons. And this was in 2009. She said, I have so many people in my cohort, my graduating class, who went for the wrong reasons and got out into the field and realized they couldn't do it, or nursing was not for them, or they got into it for the money and they burned out immediately. She said, the best advice I can give you is go be a CNA. Go start from the bottom and work your way up to the top and see if it's really for you. That's how you'll know if you really want to be a nurse. I said, okay. And I went and got my CNA, baby, 2 years later. And after becoming a CNA, I said, this is not enough. I want to do more. These residents are like not getting the care that they need to get. I need to go back to school. I went back for my LPN. I graduated. And I said, I want to do more.
Yeah.
This is not enough.
It's an addiction.
I got to do a little bit more. Like, I can help people in other ways. I can help people more if I go back to school. I went back for my RN. I went into the hospital, and I really saw, I think that's where my passion came from, wanting to give people of color like that representation that you do have support in healthcare. I worked at a primarily Caucasian hospital in a very suburban area in St. Louis. And it was just really sad to see how the people of color were treated, especially if they didn't have a lot of knowledge of healthcare. And I think after that, that was really my push to go back and say, I can be a nurse practitioner and I can be the one putting in the orders.
Yes.
I can be the one guiding care. And so I just had to figure out which specialty I was going to go down.
I love it. I love it.
What about you, girl?
All right. So for me, my story is a little different. I will say, I always tell people I didn't choose the nursing chose me. And I'll tell you why. So growing up, it was a little different in my household and in my family. I wasn't talked to like about college. I wasn't talked too much about school. Honestly, I don't even know if I knew too much about what a nurse was. I do know when I was 12 years old, my grandmother was sick with lung cancer, and we took care of her at home. I remember them bringing the bed in and us taking care of her until she passed away, which I now know meant that she was on hospice. I knew then at that moment I wanted to help people, but I didn't know how I wanted to help people. I do know I enjoy helping my grandmother, and I loved how we all rallied around her as family and taking care of her. I was about 19, and my friend asked me to give her a ride because she was going to sign up for school, and I had a car. So I took her, and when I took her, the man was like, hey, do you want to sign up too? And I was like, sure, right? I didn't even know what was happening. She didn't get accepted, but I did. And that's how I got into CNA school, which is pretty funny.
Wow.
So I knew absolutely nothing about a CNA. I didn't know anything about it. I had just found out I was pregnant when we started with my daughter. So I was pregnant with my first child. I'm in CNA school. The girls that's in school will tell you, in clinical, I was like, I can't do this. It's not for me. They have to like clean my patients for me. They like, we gonna help you get through this. I was like, oh, no, I can't do this. What are y'all talking about? So I'm like, this is not for me. But I got my first job, and I loved what I did. I realized I loved helping older people. And I think it's mainly because my grandmother had passed away. My other grandmother passed away. I never had a grandfather. So it was something about older people that attracted to me. I love taking care of them. I love listening to their stories. I loved helping them and being the one to help them get dressed in the morning, to be the one to comb their hair, to bring them perfume and allow them to smell better and feel better. So I love that feeling that I gave them. I was a CNA for about 5 years, and I remember being in those rooms and a nurse not answering the call lights and to be like, your patient light is on. I'm like, but you were in there. So I remember telling this one nurse, I'm gonna go back to school and do what you do so I can show you how to do it. And that's when I went back to, that's when I went to LPN school. I went to back school of nursing in Redbud. And it's funny because when I took the entrance exam, when they sat me down and did my interview, they were all looking a little weird. And I'm like, what's wrong with y'all? They was like, you barely missed any. And I was sitting there like, okay. Hey, like, how you do it? I don't know, I just did it. You know, like, I couldn't tell you how, I just did it. So I went back to LPN school. I had an amazing career as LPN. I did some crisis and detox and behavioral health, things like that. But I was in a box. And if you know anything about me, I don't like to be in a box. I don't like people telling me you can't give that med, you can't do that order, you can't do this and that because you're an LPN, which people love to say, but let's be clear, I was a great LPN. So my cousin Rotunda was like, we should go to RN school. I was like, no, I don't want to be an RN. I just want to be an LPN. I didn't have a goal for myself because, unfortunately, I didn't know enough to know enough, right? But I did that with her. We got in. That's when I went to Lutheran School of Nursing and met you. I was smart, remember? Like, what? And so I always tell people, I'm not speaking religion to nobody, but I always tell people, God designed this for me before I even knew it was made for me because there is no way I made it through this the way I did without even knowing enough. I feel like these steps were already ordered for me. And so when we went back to RN school, I worked at Touche Regional Hospital for the most part after I graduated. And that's where I was born at. So the care we gave in the community that I'm from, a community that's super underserved, super underrepresented. They're literally in a food desert, right? You see a lot. This hospital, though it's a community hospital and we didn't have all the luxuries, this is all they had. So we gave them the top-notch care that we could give with what we had, right? But also we had sometimes people working who I don't think understood us enough, who took care of us the way I thought they should. And then I had a nurse practitioner was like, Tiara, you so good, you should go back to school. She was like, I'm telling you, I watch you with these people. You should go back to be a nurse practitioner. Shout out to Mikasa Crawford. She gave me the link. I signed up. I became a nurse practitioner. I knew I wanted to do family. It was so funny because we was like, I'm not doing it. I'm not doing it. I'm like, I'm not just doing psych. She like, and I don't want to do it. So even at the school, I did family. And when I tell you, I think I tell everybody, I love what I do. I genuinely love what I do. I love to get that patient that come in with an A1C of 14 and I can turn it around to 7. I love to get that person who was scared of high blood pressure medicine because of the stigma around it and their blood pressure was so elevated, but I was able to get them to trust me to take these medications, to educate them about the medications, the lifestyle changes, all these things, and now their blood pressure hadn't been controlled in 10 years, but it is now because of me. I love having those conversations with people who are scared to get their colorectal screenings or their breast cancer screenings because they're scared that theirs are going to be positive, right? I love just the difference I make in these people's life, and it's just little old me. I'm just me, right? We're just individual, regular people making a difference in somebody's life every day. And let's be clear, we're not perfect, right? So we may not always hit our mark, but for the most part, when we do, it's just like, I'm doing God's work. You know what I'm saying? And if you don't believe in God, I get that. Whoever you believe in, right? I'm like, I am doing something that the little girl in me coming from where I came from, I never saw. I definitely know I suffer from imposter syndrome because there's no way being from where I'm from, I am where I am today. So I do what I do because I was meant to do this. And I know this because of the feeling I feel when I do it. No matter how much a patient get on my nerves or give me a bad day, I still leave work every day saying I love what I do. And that's why I chose nursing.
Yeah.
So
It is really a calling. It really is a calling.
Yes, for sure. So what's next?
Yeah. So I think to start wrapping up a little bit, I want to throw in a question.
Okay.
What was one moment that changed how you viewed the profession as a whole?
Okay. So I will say, I probably was really naive. Going into nursing, I feel like these are successful people. These are people that care for people, right? So there's no way there's nothing else in here. I worked at a place which I won't say, but when I say this all the time, they treated me like the bottom of their shoe.
Yeah.
That's literally how they made me feel. They didn't speak to me. They didn't acknowledge me. I was good, big, and pregnant, so you couldn't help but see me. And they literally made me feel like trash. Even up until the point telling management that I put something in the shred bin that's supposed to win in the patient chart that I knew I didn't put in there. So I was like, hey, because it's by the med room where the shred bin was at, so it's cameras right there. I said, we have cameras in this nursing station. Pull them. If I did that, you pull them. They never pulled it. But that's when I knew, no matter how successful I was, no matter what I accomplishment, there are still some people out there who don't just respect who I am because of who I am. So that also made me know that I wanted to uplift those that look like me, that come from where I come from, that's on this journey I'm in, because there are still people who feel like we're not supposed to be here. There are still people that don't want us here, right? And so it didn't change the way I looked at the profession, but it changed the way I looked at some of the people in the profession. And I knew, being who I am, I have to navigate it a little different in this profession. Yes, I'm still gonna walk in confidence. I'm still not gonna let anybody turn me down. I'm still gonna show up every day being exactly who I am, but you have to learn how to navigate it.
Yeah.
What about you?
I think the moment that resonates for me the most when I think about that question is at the same job I was at.
Yeah.
After graduating with my RN, I was in orientation, and the nurse did not look like me. I'll just say that.
Okay.
And we had, I think the nurse to patient ratio was like 7-1, and probably 4 of those 7 were primary care.
Okay.
Because we were always short-staffed. And she's like walking me through her day, like, I'm gonna get report from the nurse that's leaving on night shift. I'm gonna check the chart, review what medications I have at what time, and I'm gonna start my morning med pass. She goes to the Pyxis, she gets all her meds for her patients, and she goes in the room and starts giving her meds. The first room we went in was a older black lady that was so sharp and with it.
I love it.
And the nurse hands her her medication. She's like, "Hi, I'm such and such, and I've got your morning medications. Here you go." And so the lady's looking in the container, and she's like, "None of these look like any of my home medications. Can you tell me what these are?" The nurse had no clue what the medications were. She didn't even know what some of the medications were for. And I think I came home that evening and I told my husband, like, I am not sure I'm in the right profession, because it seems like everything is so task oriented. Like, is that what nurses are becoming? Is that what we're supposed to be? You know, you're just checking off this kind of workflow, and there's no real care or no real passion being put in it. There's no way I'm taking care of a patient and I don't know what they're getting or why they are getting it, or I can't even explain it to them. Especially so many people, I'm sure, can be in the hospital, can be at a doctor's appointment and be told all this medical jargon from the healthcare provider and have no idea what they said. No idea what they just said. No idea what their diagnosis is. No idea what their prognosis is. No idea what medications they're supposed to be taking, why they're taking them. And as nurses, that's what we're supposed to do. That's what we're there for. And I think that kind of changed how I viewed the profession a little bit, because I kind of, like you said, I thought going in like nurses could do no wrong. There's no way people are handling other people's lives in their hand and they don't know what they're doing, or they're not trying to know what they're doing. So I think that really changed things for me. And honestly, that was almost 10 years ago.
Yes.
I still feel like that. And
worse.
It's probably worse
It's probably
now.
worse.
It's probably worse now. So I think that's even more the reasons why nursing in general needs representation like this. Not just from what we look like and the color of our skin, but that we can be, the educators to the people who need it. I think right now a lot of my job is de-prescribing and prescribing medications. And I always tell my patients, what are you taking this for? What's the dose? When should you be taking this? Please give that back to me. Give me that information back so I know that you know. And I think that if more of us did that, then there would be many more informed people and there would be less misinformation out.
I always tell people, one of the reasons most people do like to see advanced practice providers is because of the education we give. I'm always telling, if you educate your patient and get them to trust you, they're more likely to be receptive to care, to be a part of their care, and to be compliant with their medications and their treatment, literally.
Yep. We need that.
We need that for sure.
We need that. So we don't want to take up all your time today, guys. We do hope that you enjoyed our first episode of our new podcast. Like Tiara said, please give us ideas of what you guys want to hear, what questions you guys have, what you guys want to see from us over the next couple months,
who
weeks.
You want to see, because we will have guests. All those things, because we're open to it. Yes, we do have our ideas. We do have guests lined up, but we want to make sure we are catering things to your needs. So please feel free to drop it below, drop it in our comments, shoot us an email, whatever you need, because we are here to be a resource for you guys.
Absolutely. So before we wrap up, we do want to share a quick reminder.
Yes, the conversations on Nurse Talk 101 are for educational and informational purposes only. We're speaking from our own experiences and perspective. We're not giving medical, mental health, or clinical advice.
please, please know that this podcast does not replace care from your own healthcare provider or mental health care provider. If you're struggling and in need of support, we encourage you to reach out to a trusted healthcare professional.
Yes. So that is it for today's episode. If something we talked about resonated with you, please take it and leave what you don't, because please know you're not alone.
Thanks for spending time with us. Make sure to follow and subscribe. Share this episode with anybody you think may need it.
And until next time, take care of yourself.
We'll
talk
talk
to you
soon.
soon.